providers are the front line. You're taking in, you know, the worries and stresses and just concerns of the patients around you, and you bring that into yourself, right? And it needs somewhere to go, so it doesn't necessarily come home to your family or stay in you.
Being happy with who you are and what you're doing, being well rested, eating well, exercise, those all make you feel better, and so then I think you can perform better at your job.
Being in healthcare is very stressful. There's, care fatigue. You're seeing a lot of different cases coming in, especially working with our patient population. Sometimes you feel like you want to give them the best care that you can, and sometimes that's difficult.
So if you're not sleeping well, if you're having trouble getting through the night, if you're waking up really early and feeling tired all day, and then if you're not able or motivated when you do have time to be happy doing the things that you enjoy, I think those are signs.
Anyone who's looking for support, starting with a counselor is a great place to start.
I think there's a lot of stigma in reaching out for help. I think not just as healthcare providers, but as humans, we fear reaching out.
There's this really beautiful video on YouTube of this person, black and white video of this person walking through life, and he comes across these folks who, have these like storm clouds, around them. And he meets them, he talks to them, and he takes in the storm cloud. And he goes on to the next, and it just fills him up as he's walking through. And I think providers need to recognize that we're a little bit like that, right? We take so much of that in, even if we have great support, great coping skills. It's still something we take in, and it still has an impact on us. And we deserve support too. Your brain is an organ, just like any other part of your body, right? So it's not that there's something wrong per se. It's just if one part of your body needed a little attention, you'd go to the doctor. If your brain needs a little bit of support and attention, you go to a mental health, clinician or provider. We're all people, and we all need someone to chat with sometimes. We all need a listening ear or just a little bit of support.